Gastritis is an inflammation of gastric lining, which is also called gastric mucosa. It affects around 20% of world population. It means it's fairly common disease. Most important and most common symptom is upper abdominal pain, which is described as a gnawing pain or burning sensation. It has no direct correlation with eating, but sometimes it can be relieved by eating. Second most common symptom is nausea and sometimes vomiting. Most common cause of gastritis is Helicobacter pylori. It is responsible on 90% of cases, and sometimes chronic consumption of alcohol and non-steroidal anti-inflammatory drugs, which are used primarily as painkillers, also is cause. Most important complication of gastritis is peptic ulcer disease, and this peptic ulcer can develop after gastritis. This is gastric peptic ulcer, and peptic ulcer can develop in both in gastritis in our stomach, maybe here or other part of the stomach, or it can develop in duodenum or in small intestine, which is called duodenal ulcer. So ulcer can be gastric ulcer or duodenal ulcer. And why is so important also gastritis and chronic gastritis especially? Because it has risks, and it carries risk of stomach cancer, and stomach cancer occurs in 1 to 2% of cases who are infected by Helicobacter pylori. So Helicobacter pylori is important infection even sometimes person have no symptom, and its gastritis is mostly asymptomatic. Now let's say about treatment. First line of treatment is combination of several drugs. First is proton pump inhibitors, PPIs, which are omeprazole, lansoprazole, or pantoprazole. So one of these are used, and combination of amoxicillin and clarithromycin is used most commonly. This regime typically prescribed as 10 to 14 days. If this treatment is not responsive, then second line and third line treatment are prescribed, which are combination also antibiotics and more complex. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.